Hi everyone. I just want to quickly explain next Wednesday, so week 9, is a staff planning day. So there's no scheduled class on that day. But having said that, this lesson today might take you a bit longer than today's session. So see how you go for time. But if you're not done at the end of this morning's lesson, I'm happy for you to work on that over the next few days. So I'll say that the worksheet for this lesson is due at the end of when we would have next Wednesday's class. Sorry about that, but obviously getting towards the end now, sometimes there's going to be a bit of extra work. If you don't get everything done today, just make sure you comment in the Google Classroom post so I know that you've started on it and I can mark you as attended. If you do get it all done today, great, just submit it as usual and then I will get that. I just want to note as well, there's a lot of written content in this particular lesson. So I have uploaded the slides as well. The reason I'm kind of warning you about that is if you try to write down everything that's in these slides, it's going to take a long time and it's not a good use of time. So what I want you to focus on in this lesson is, maybe really summarizing the key points and focusing on applying your knowledge or your understanding rather than trying to write everything down. And you'll see that when I've linked to questions, I've made those questions more application, like it would be in a SAC or an exam, rather than you just trying to copy down everything because there is a lot. Okay? So we looked in the last lesson at the rationale and the objective of the Sustainable Development Goals. If you haven't done that lesson, you need to go back and do that first, okay? You really need to understand what these goals are in general before we look at what we're doing today. Today, we're going to look at the key features of the third Sustainable Development Goal, which is to ensure healthy lives and promote well-being for all at all ages, or as we call it, SDG 3, good health and well-being. Okay, this is always a focus in the exam. You do need to know this information. So just a bit of a recap. The Sustainable Development Goals are 17 global goals. They were created by the UN, the United Nations, in collaboration with lots of countries, and they're aimed to basically meet a whole wide range of targets by 2030. With the focus on improving people, planet, prosperity, peace, and partnerships. Okay, that's kind of just the snapshot of what those goals are. SDG 3, good health and well-being. Okay. The overall aim of this SDG is to improve health and well-being and to extend life expectancy for all people at all stages of life. In the last lesson, you remember there was a lot of inequality achieved at the end of the MDGs, the Millennium Development Goals, where not everyone got the same thing. So this is really focusing on making life better for everyone. It includes some existing priorities from the MDGs, as well as some new issues. So we'll just briefly look at that. The things that carried over from the Millennium Development Goals in relation to health and well-being were maternal health, still a lot of work to be done in that, child health, communicable diseases, so things such as AIDS, malaria, tuberculosis were still not fully addressed, and access to sexual and reproductive health care, which you'll probably note relates quite well to those two. New priorities that were identified in 2015 for the Sustainable Development Goals were things like non-communicable diseases, so our lifestyle-related diseases, because there was a huge increase in those around the world, especially in low and middle-income countries. Mental health and well-being became one of the features as well. tobacco use, which relates to non-communicable diseases, but is kind of its own priority as well. Substance abuse, pollution, and road traffic accidents. Okay, so these are all things that weren't necessarily identified in the Millennium Development Goals, but came into the SDGs. Okay, so just pause here, jump into the Google Doc and answer question 1. Okay, this is a first example of a fair bit of writing. To be honest, I would say of the slides, of the things that you should write down, this is probably the one. The rest of the slides will talk about the information in this slide, but this slide is basically a summary of the key features of SDG 3. And that's what the study design says you need to know, the key features. Now the features, if you went into the website and in the Google Doc I've given, oh wow, the picture just fell on my head. If you went into the website, I've given a link to the SDG 3 page of the SDG website. It will list these as numbers. You don't need to know the numbers of each feature, but you do need to know what they include. And so I've broken it down here into 2 categories. One is kind of the actions or the means of implementation, so the ways that things can be achieved. The other side are the actual targets, or I guess the outcomes, what we want to achieve. So as we go through these headings should make a bit more sense. So the means of implementation, or the actions, are to achieve universal health coverage. This is probably the big one in terms of the actions. So this is saying that every person universally in the world has access to healthcare, including access to essential medicines and vaccinations. Another mean of implementation is ensuring an adequate and well-trained health workforce in every country. And that's kind of crucial to achieving universal health coverage. You need to have trained people to provide those services. Access to sexual and reproductive healthcare services. Strengthening the implementation of the World Health Organization's framework on tobacco control. Okay, so that's a specific set of guidelines about how to reduce tobacco control around the world. Research and development is a really, really big one that we need to keep developing new medicines and new vaccines. I think this year more than ever, the importance of research and development and collaboration has been so important in terms of how do we deal, with a crisis such as COVID. Strengthening the prevention and treatment for substance abuse, remembering this is a new priority of the SDGs. And strengthening the capacity for early warning, risk reduction, and management of health and wellbeing risks. And again, COVID is an excellent example of that, of a pretty sudden, urgent, unexpected disaster. Countries needed to have things in place to manage those risks. Okay, so these are all things that countries can do, I guess is a good way to put it. Things that they need to do. And over here, these are the things we want to achieve. We need to reduce maternal mortality. Okay, so things like access to sexual and reproductive healthcare services helps us to reduce maternal mortality. End preventable deaths of newborns and children under 5. Okay, so still that focus on child health. End the epidemics of AIDS, TB, malaria, and these things called neglected tropical diseases, which are a range of really horrible diseases that tend to affect certain countries. Combat hepatitis, waterborne diseases, and other communicable diseases. So both of these relate to communicable disease. Reduce non-communicable diseases. Promote mental health and well-being. Reduce road traffic accidents. Reduce substance abuse. And reduce deaths and illness from hazardous chemicals, pollution, and contamination. Okay, so I know there's a lot in that, and the rest of this lesson will kind of be breaking down these things and applying that knowledge. But this is kind of what you need to have written down, and you really, I would say, I'm going to asterisk things that you absolutely should know. So the first one is the achieving universal healthcare. The well-trained workforce leads into that. Tobacco control. I would probably look at this just because of the year that we're in. There's a good chance they could put that in the exam this year and say, you know, that this is so important. In terms of your targets, maternal mortality, child mortality, this one in particular, these communicable diseases, non-communicable diseases, I would say road traffic accidents could be a focus, and possibly this one because it ties in really well with another SDG that we're going to look at. Okay, so once you've jotted those down, jump in to question 2. Right, as I said, I don't want you spending time writing down everything that's in the rest of these slides. Save the copy of the slides that I've uploaded, use them as you go through it, but I really just want you to practice answering questions. So the first feature that we're going to talk about of SDG 3 is maternal mortality. The specific target, again, you don't need to know. I've never seen them ask you to give the exact numbers of the target, but you should know that, you know, reducing maternal mortality is a focus. Specific target is to get the maternal mortality rate down to less than 70 deaths per 100,000 women by 2030. Okay. Some of the things that cause maternal mortality, the reasons that women die either during pregnancy, remember this is pregnancy, up to 6 weeks after the birth. Okay, that's considered maternal mortality. Reasons for this include excessive bleeding or hemorrhage, infection, or that's called sepsis, obstructed labour, unsafe abortions is a really big one. We've looked at a few of these things before. And high blood pressure or hypertensive disease. They're the main reasons that women die during pregnancy or childbirth or in the few weeks afterwards. Some of the strategies that can decrease this are things like access to sexual and reproductive health care, which we've already mentioned, antenatal care, so specifically care during pregnancy, having skilled birth attendants. Okay, so that's having, you know, someone like a midwife or a nurse or a doctor available during the childbirth. And also family planning. That links obviously a lot to this kind of healthcare, but particularly the focus in family planning is around delaying the age of first pregnancy. We've looked at, you know, gender issues and how a lot of women are giving birth, you know, in their teens, when the body's just not quite ready for that. So being able to delay the age that women are first having babies, and then also increasing the spacing between babies. So, you know, having a couple of years between having babies so the body can fully recover. Okay, they are the strategies that will help us to reduce maternal mortality. A very similar focus then is ending the preventable deaths of newborns and children. Okay, specific target, again, you don't need to know the numbers, but end preventable deaths and decrease the under 5 mortality rate to less than 25 per 1,000 live births. The causes of infant and child deaths are premature birth. So the majority of child deaths happen to babies very, very, very young. Respiratory infections, so lung infections. Birth asphyxia, so basically that's the obstructed labour. Often it's the cord wrapping around the neck, or really, really long labours where a baby stops breathing. Communicable diseases, so remember we're looking up to the age of 5. So things like malaria, cholera, tuberculosis, AIDS, they're all examples. Malnutrition, diarrhea, we've looked at this before in terms of safe water and sanitation, And also injuries. So that can be things like, road injuries, or, farming accidents, lots of things like that. The strategies to decrease these child and infant deaths. Again, sexual and reproductive healthcare services. If women are controlling when they have children, their bodies are ready for it, they're less likely to have premature births. There's less likely to be complications during the labour. Also, it means that women have control over how many children they have. That's a huge one for things like malnutrition, having the children you can afford. Skilled birth delivery. Again, that stops things like this. So these kind of things protect both the mother and the baby. Breastfeeding, big one that relates to our malnutrition. Vaccinations to reduce communicable diseases. Clean water and sanitation, that links well to our malnutrition and diarrhea. Nutritious food, again, malnutrition. And access to essential medicines and healthcare when a child does get sick. Because look, we're aiming at reducing deaths. So, being able to treat children when they are unwell. All right, I want you to go into question 3 now, and you're going to apply what we've talked about in this and in the last slide. Okay, the next feature is reducing communicable diseases. And they have some specific diseases here, talking about ending the epidemics of AIDS, TB, which is tuberculosis, which is a lung infection that can be fatal, it can cause death, malaria, it's carried by mosquitoes, and these neglected tropical diseases. So these, when they say end the epidemics, they basically want to stop these diseases completely. So the cause of AIDS, obviously it's the HIV virus that causes AIDS, and that virus itself is spread through bodily fluids. So that can be through unsafe sex, it can be through from a mother to her baby, either during pregnancy or in breastfeeding. It can be through sharing of blood. So that could be after an accident, if blood was exchanged, or through things like unsafe sharing of needles, syringes. Okay, so the strategies to reduce AIDS are education and awareness, prevention strategies, so things like providing condoms or having safe exchange of syringes so people aren't sharing those things. The really big one is decreasing the stigma around this disease. So people are more likely to seek diagnosis and treatment. Early diagnosis is key. There is no cure for AIDS. There's no cure for the HIV virus at the moment, but it can be treated. Okay, so these antiretroviral drugs are really effective at stopping it from developing into AIDS, and also stopping a person passing it on to someone else. So early diagnosis and then very rapidly getting onto these medicines. And then also still a huge amount of work being done on research for a vaccine. Causes of tuberculosis, it's a bacterial infection that is spread through coughing and sneezing. The strategies to decrease the spread of tuberculosis, again, that really early diagnosis and treatment, so people aren't passing it around. Improved reporting, so knowing where the cases are. Again, COVID's a really good example of what that looks like, tracing people that have it, contacting people they might have come into contact with so they can get tested and treated. Having clean water and sanitation, so the bacteria can't spread through that. And again, research. And so research into drugs and vaccines. Malaria is spread through mosquitoes, so it's actually a protozoan pathogen, but it is spread through mosquitoes. Strategies for decreasing that. Mosquito nets, they're one of the most important health things in the world, which you might not think, but they save huge amounts of people every year by stopping mosquitoes getting to them. Similar insecticide sprays, so spraying inside houses so mosquitoes don't gather there. Having clean water sources. Mosquitoes love stagnant, dirty water. Again, early diagnosis and treatment, so we're not getting these really bad symptoms and death. And research, again, you'll see research comes into a lot of these things. And then finally, these neglected tropical diseases. This is a group of around 20 diseases. They're pretty horrific. We're talking things like parasites that infect people's brains, various types of worms that can cause really horrible problems. So they're caused by a variety of different bacteria, parasites, viruses. Because they're a wide range, there's no specific strategy, but things like developing and giving access to essential medicines, again, research into what these diseases are and how they're spread. Again, things like our clean water and sanitation, mapping the disease, notifying people so they can get tested, and vector control. Again, this is things like mosquito nets. Vectors are things that carry disease. Okay. Again, I don't want you to try and memorize all of this, but jump into question 4 and choose one of those diseases and discuss a couple of the strategies that could help reduce that disease. All right, another one, I've put this on its own slide because it is a bit bigger, but another communicable disease that is specifically mentioned is hepatitis. The aim is not to completely end this, but they have just used the word combat, which obviously is a pretty loose target. But hepatitis is a disease that affects the liver. It's a viral infection, and there are 5 different types. They're all quite different. But the causes of hepatitis, hepatitis A and hepatitis E are spread through infected food and water. Hepatitis B, C, and D is spread through bodily fluid, blood products in particular. So things like, again, unsafe injections, IV drug users that share needles, blood transmission, maybe after accidents, medical procedures. A lot of countries don't have the resources to have really good sanitized products and all of those kind of things that we would have here. So some people contract hepatitis in hospital. And also sexual contact, but that's a more rare type of transmission for hepatitis. Strategies that can reduce this, large-scale vaccinations. So there are vaccinations available for most of the types of hepatitis. Clean water and sanitation, again, because some of it is spread through unsafe water. Diagnosis and treatment, again, if we can treat people, they're less likely to pass it on. Safe surgical practices, so in hospitals, having access to, gowns and gloves and masks and all of those things that we kind of take for granted. And also needle or syringe exchange programs can be a really effective way of preventing people from sharing needles. All right, now we're moving on to, sorry, I've moved a word there. Make sure you have non in there. Non-communicable diseases. This is a big focus of the SDGs that wasn't in the Millennium Development Goals. The target is to reduce the premature mortality, so the early death associated with non-communicable diseases by 1/3 by 2030. Remember, non-communicable diseases include things like cardiovascular disease, stroke, obesity, type 2 diabetes, liver disease, and a range of cancers. These are what we often call our lifestyle-related diseases. They're not caused by bacteria or viruses. They're caused by poor lifestyle. Okay, so some of the causes are things like processed foods, high sugar intake, tobacco, alcohol, and poor physical activity. We're aware of all of these things. We looked at a lot of this in Unit 3. Strategies, again, none of this will be new. Strategies to decrease non-communicable diseases are things like having our taxes on alcohol and tobacco. Again, this WHO framework on tobacco control. Labeling food so people know what's in it. Education. Taxing sugary drinks. Monitoring, so looking at the trends and seeing what's working, what's not working. Health promotion. Okay, we know Australia focuses a lot on health promotion. Other countries don't do so much. So there's a big focus on countries improving their health promotion activities. And of course, access to healthcare, making sure people can access treatment when they need it. Okay, so jumping to question 5, there's 3 parts to that. One is looking at that double burden of disease. It's a term we brought up at the start of Unit 4, but the double burden of disease looks at how low-income countries, traditionally their main problem with things like communicable diseases and malnutrition, which is what caused the majority of deaths, but now they're also seeing huge increases in these non-communicable diseases, so things like obesity and diabetes and cancers. So they've kind of got this double burden of these traditionally low-income diseases as well as these newer lifestyle diseases. And then I want you to identify one non-communicable disease and explain how a strategy could decrease that specific disease. All right. Promotion of mental health and wellbeing is a new focus as well of SDG 3. And again, we know what a lot of the causes of poor mental health and wellbeing can be. Poverty can be a huge contributor to things like stress and anxiety and depression. Unemployment, same thing. Discrimination, so not having equal rights, can be a huge cause. There's often genetic factors. A lot of people with mental health issues don't necessarily have a particular reason for that. Conflict, so imagine living in an area of war, or even things like climate change and being really worried about your future. Trauma would link a lot to that, as well as things like family trauma or domestic violence. And disease as well. Being unwell is often very closely linked with having poor mental health. Strategies to increase this at a really general level, ensuring that people have human rights. Okay, that's going to decrease things like that. And that often requires actual anti-discrimination laws. Funding a mental health workforce, I guess you could add into that training them. Okay, so it's a really new area for a lot of, especially low-income countries, where they haven't had the resources for mental health. So, training, often it might be training existing health workers to also recognize and manage mental health issues. Early diagnosis and treatment. The same with everything. The earlier something is picked up and is treated, the better. And again, health promotion. So these, messages around what mental health is and how to maintain positive mental health and what to do if your mental health isn't good. Just go in and answer question 6 for that one. Oh, sorry. Okay. 2 more. Substance abuse. Again, it's a new focus of SDG 3. And this is to just kind of strengthen the prevention and treatment of these issues. Substance abuse, here we're talking about alcohol and drug use, often very closely linked with mental health issues. So often improving mental health can impact substance abuse. Just a lack of awareness or understanding of the dangers of substance use or the addictive nature of a lot of substances. Easy access. Often in a lot of countries, it's very easy to access alcohol or drugs, and also it can be very cheap, which obviously can make those decisions easier for people. Also, people who've been exposed to trauma. Substance abuse is often a coping mechanism for people that have had extreme trauma, whether that's family trauma or things like conflict. Strategies to decrease this, again, education, health promotion, having stronger policies and laws around things like legal age limits, but also, cracking down on drug trades and things like that, and having access to rehabilitation and treatment. This can be a really tough one because, again, there's often a lot of stigma associated with substance abuse, but ensuring people can access treatment. Another one is harm reduction. This relates to things like, safe needle exchanges. This doesn't necessarily reduce the use of substances, but it basically says that while people are using, let's ensure that they're doing it the safest way possible so that we decrease the chances of things like hepatitis or HIV. Okay, and the last feature is the feature of hazardous chemicals and pollution. The target is to substantially reduce death and illnesses. Again, that's not very useful. What does that actually mean? But the goal is to substantially reduce the death and illnesses caused by chemicals and pollution in the air, water, and soil. This one links really well with one of the other SDGs that we'll look at a bit later on. The main causes of these problems are air pollution from cars, factories, and burning, so burning of forests and things like that to clear land for farming. Not having good waste disposal. So in a lot of places, waste is just kind of left on the streets. It'll often contaminate waterways and it can seep into soil. Contaminated water, as I just mentioned, and things like dumping of chemicals. So a lot of factories, if there's not strong regulations in place in countries, factories can dump chemicals either in the ocean or in waterways or in soil. And also tobacco use. We're looking at air pollution as well, so tobacco use can contribute to that secondhand smoke. Strategies for decreasing these issues are things like diverting from fossil fuels. We need to stop using coal and gas and oil as our fuel sources. That means investing in renewable energy sources. Having more people using public transport, so not everyone's using a car or a motorbike to get around. Improving waste disposal systems, having adequate garbage collection or ways to dispose of chemicals and things like that. Clean water and sanitation. Again, a lot of countries still don't have that in place. And then obviously our smoke-free laws, our WHO framework on tobacco control to decrease that secondhand smoke that is in the air. Okay, so just jump in and answer question 7. I know there was a lot of information in this, but hopefully you're focusing on applying it to questions rather than trying to remember everything that is in these.